let's say if I lay down on my back, when I breathe, start to hurt. Oh. And then at night, like 4:20, I woke up with a pain. I said, my God, this hurts so much. Now, since last night, it's all the time.
All the time?
All the time. I'm taking Tylenol. It's very bothersome, very bothersome.
Let me introduce myself first, okay? My name's Dr. White. I'm not going to say I'm the best, right? But I'm pretty good, okay? I have NFL player come here, Olympic coach, Asian player come here.
Yeah, we saw.
You saw a picture. And then PA trainer, medical doctor too. So let me try to explain to camera because I try to compare before after. I want to see any improvement for the patient. At the same time, some insurance, they're going to ask me.
That's fine.
Yes. Okay. Okay. How do you find out about me?
We were looking for clinics close to our home. And they're open on Sunday.
Oh.
You know.
Oh, you live nearby?
Yeah, we live in Sealy.
Oh.
Not too far, but you know. And then we first I thought, okay, maybe I should go to acupuncture and stuff. But I said, you know what? But I would like to take an X-ray. And then my wife found out, said, oh, this doctor, he will take an X-ray. I said, okay, that's good. So what happened is on Monday. I do kickboxing, Muay Thai, right? And I also have a gym at home and I lift weights.
Okay.
So I was doing, in Monday, it was my off week. I was off work, vacation time. So I was doing my sequence. I did squat, and then I think I can do, because I took Tylenol, so the pain is manageable. So when I was doing barbell row, instead of doing like this, I just did like this, and then I felt something hot in here. Oh. So that's fine. Then at night I went to fight here on Revolution Dojo, not too far from here. Is right across here on 90. And I fought, but I said I'm going slow on the kicks and stuff and rotating kicks. Came back home. So then start feeling pain. Let's say if I lay down on my back, when I breathe, start to hurt. Okay. But then if I turn and sleep on the left side, no pain. Then Tuesday I woke up and told my wife, well, I'm gonna rest. I'm not gonna fight today, just relax. And you know, I found a few positions. I was taking Catafan. And so the pain was manageable. It has been manageable. Tuesday, Wednesday, and Thursday, Friday. Actually, said yesterday, even before we went to bed, you know, I put my vest, I put a belt to stabilize a brace. And then I showed her yesterday, I kicked and all that. I said, everything is great. So we went to sleep. And then at night, like 4:20, I woke up with a pain. I said, my God, this hurts so much. And so on my daughter's bedroom, she's not at home, but her mattress is firmer than my mattress. So all this week, I have been going to her bed and sleep well there because it's a little harder. I went this time and I was laying down on the left side thinking that it would improve. Didn't improve at all. So when I stood up, even to move, it was like is a pain, like a big pressure, like somebody is kind of like there is a weight pushing down, right? The pain started over here and comes to the side. So at first I thought, okay, did I hurt my kidney? So well, no, because otherwise I would have fever. And probably I would have blood in my urine. I don't have that. Did I hurt my lungs? No, because otherwise every time I breathe in any position it would hurt. So it is deep. It's not right here close to the skin. It's deep, and it's only when I make some movements. But right now, since last night, it's all the time.
All the time?
All the time. I'm taking Tylenol. It's very bothersome. Very bothersome. So that's why we came to see you. Hopefully the X-ray will show something.
Okay, I'm taking X-ray.
And then
so make sure you don't take Tylenol every day, like you go damage your liver.
No. I only took today. Only today because it was very painful. And then when I usually when I stand up from bed, it hurts a little bit. But as I stand and then I kind of wait a little bit, it gets okay.
Okay.
It doesn't stop me from walk, but I feel that pressure, like if somebody has a hand like that, forcing it inside.
Okay.
Comes from here all the way here.
Okay.
Only exactly what my hand is.
Okay.
That's where the thing is covering.
So
Right here.
all this. So if I press in, you feel pain already?
No.
No, right?
No, a
Okay.
little bit above,
A little bit.
above.
How about lean back? You feel more pain or lean forward? Lean forward. Which one you feel more pain? Lean back or lean forward?
Lean forward, right
Lean
here.
forward. Oh, okay. I see.
Right here where my finger is.
Right, I see. So like he is okay, right? Mainly here.
Yeah, it's mainly in this area here.
I see.
Not going down, so I don't know. I don't think it is a sciatic nerve.
It's like,
I think
okay.
it's
So
something else.
one side. Okay. It's okay. This side is okay, and then.
Right now it is because of the Tylenol.
Ow!
But this morning he couldn't turn at all.
He couldn't turn it off.
Yeah, but right now turning this way, it hurts all the way in here, right here.
Okay, I see. And then just since like last week, like
Last week everything was fine. From Monday, Monday is when it happened. But from Monday all the way to Friday, I've been resting and I've been, it hurts here and there. But some positions, I like laying down on my left side, the pain would go away.
okay,
So perhaps something would relax in here. But I don't understand what happened last night. Maybe I was sleeping in a certain way that twisted it again. I don't know.
I see. From 1 to 10 times worst pain, what's the level? 4, 5, 5, 6, 6, 7.
Today, when I woke up, like standing up was a 7 to an 8.
Okay.
But then, once I stood up, yeah. But like I said, like moving this way right now, it doesn't hurt so much, just a little. But moving the other way hurts a lot more.
Okay.
I think for my age, I'm pretty good.
Yes.
Yeah. I still can fight with the 20-year-olds.
Oh my God.
Yeah, we make jokes over there, and they call me Papa. They say, "Okay, Papa, let's go. Let's see what you're made of." I said, "Son, you're going home on an ambulance today. Let's go." I'm pretty strong. Praise Jesus. I'm pretty strong.
Okay.
Yeah, but I was intrigued because yesterday when we went to bed, I was feeling fine.
Oh.
You know, I was feeling fine. It's probably during the sleep something happened. I don't know.
So you try to go to UFC or something?
Oh no, but my trainer is Larry Crow. Do you know Derek Lewis?
Yes, I heard.
The Beast from Houston. He is his coach as well.
Oh wow! Oh my
Yeah,
God!
the guys on my dojo, they are all being prepared for UFC.
Oh my
The
goodness!
kids, oh yeah. Now Israel and Ricardo is a Marine. He's getting there. He's going to be the next one to go to UFC.
Oh my God!
So I fight with him sometimes. I said, "Okay, go slow on Papa, okay?"
Okay.
Yeah, but he's a good guy. He's a good guy. So no, I don't have any.
Oh, this is good. Thank you, Sanya. Bone spur. So I can tell you, if you don't fix it, you will get worse and worse. Okay, this bone spur, right? Okay, start with 2 bone, 3 bone, 4 bone, like all this. Okay, so you can see this. You have like 3 bone spur already. So your case severe. Did you know this?
No,
No.
no.
Okay, so you can compare this X-ray. Like you want to compare to this X-ray. This is 1960, right? 65 years old. The curve should be like this. Okay, I think your wife, can your wife see this? Yeah, your curve should be like this. At the same time, all the bones should be very smooth, like this bone spur. So the bone, like right now your bone spur worse than this one, right? Okay, so later on, if you don't fix it, bone spur always they fuse together.
They get worse. Yeah.
Yeah.
Yeah, so
They fuse together, yeah.
Okay.
So almost they fuse together now. C1, C2, C3, C4, C5, C6. All these bones almost fuse together. Do you have neck pain? A little bit?
I don't feel pain here, but if I sit down too much, I feel a little bit. Yes.
Okay, so not just this, okay, this bone, right, is common sense, okay, this is C1, C2. So between these two bones, this to this. So you can still see the this here,
Yeah.
right? Okay.
Soft tissue.
Yeah, but this one like
It's almost gone.
almost close to bone to bone now. This one is close to bone to bone, like all this is close to bone to bone. When the this is compressed, right, it pinches the nerve. Right?
Yeah.
Which nerve, like from neck to shoulder. So if you don't fix it, go all the way down to the feet.
Yeah.
Like go all the way down to the hand.
Right.
So all this, yeah, your case severe.
Okay.
So like you can compare this one, all the this should be wide open, right? Yeah, this bone should be wide open. All this, okay? Yeah.
I noticed he's got scoliosis right there.
Yes, yes.
Spinal curve, yeah.
Okay, so mainly your spine not straight, right? Okay, you mentioned about mid back pain, low back pain, all this, okay, because your spine not straight. So I try to set the expectation, okay? So many patients, they expect me 1 time, 2 times, even couple months can fix it. This is impossible. Okay, I'm go down a bit, let them know anything here is okay. It's okay. I'm check here, okay? He's okay, right? Okay. I'm check this side here. This side's okay too? 1, 2, okay. How about here? 4, 5? No pain, yeah, you see the difference. Less pain, less damage. More pain, more damage. So let me know which area is damaged. So far so good. Okay.
Ow, ow.
5, 6, 6, 7?
Yeah. Right there. Go a little to the left, it's gonna hurt more. No pain.
Well, it's all upper breast area. Okay, one more time, inhale, exhale. Okay, yeah, one more time, inhale, exhale, all the way up. Okay, good, okay. The body a little bit closer to you. Okay, good. Okay, yes, okay. So I'm gonna super gentle, okay? Yes, a little bit tight. Yeah, a little bit too tight. Okay, turn to that side. When turn to one side, you hurt, right?
Yeah, it's only the right side there.
And one side?
Only the right side.
Ow! Then you mentioned about you're a fighter, right? So make sure like for two to 4 weeks you don't want to go all this like kickboxing training, low heavy lifting, because like if you do all this heavy lifting, you gonna hurt your low back even more. Okay. So beside all this, okay, you saw your spine not shake, right? At the same time, okay, like your disc compress so much it pinch your nerve. So I think I told you already which nerve, okay, from mid back. All this nerve, okay, from like all this yellow color is your nerve, like your spine not shake at the same time, okay. So all this yellow color is your nerve. So what I do right now, I'm gonna decompress your spine, right? I'm gonna decompress your spine, make more space for this nerve, okay? So I can tell you, you can go YouTube, like go Facebook, like this technique, not many chiropractors know how to do this one. Okay, so sit all the way back, okay? Oh, this is good, this is good. And then make sure you just relax. Your hand do like this. Because I try to decompress your spine, right? I try to carry you on my back. I'll be super gentle. This is the first time, okay? Let's see if I can do this one. Okay, relax upper back, give me some space, and make sure you just relax, okay? So yeah, just make sure you just relax, okay? Oh, good, good, nice, nice, nice. Yeah, you move. You have it is. Yeah, so like the bone and joint, because this is the first time your bone and joint still locking up, I try to decompress your spine. So tell me, how do you feel now? Is it a little bit better?
I mean,
A little bit better?
I feel a little bit better.
Mm-hmm.
So I think probably is about when I'm resting, right? I think I will need to rest.
Yeah, you need rest, like not do like kickboxing again, yeah.
Yeah, so I need to stay kind of
Yeah.